All right, we all know the devastating effects that the COVID-19 pandemic had on the world. Millions suffered and more than 1 million lost their lives, all in less than a 2-year period. A new book looks at how America became the world leader in COVID deaths, the government's missteps, and what the pandemic did to the world's biggest economy. It's called The Big Fail, what the pandemic revealed about who America saves and who it leaves behind. And Bethany McLean is the co-author and also a contributing editor for Vanity Fair. Welcome. As we were talking, this is heavy-duty subject matter, but definitely falls under the umbrella of you have to understand history because otherwise you're bound to repeat the sins of the past. Fair to say this is a critical analysis of what the American healthcare system and government did wrong.
I think that's very fair, and I totally agree with what you just said. I have heard people say, well, is there really going to be another pandemic? But this isn't so much understanding what to do in the event of another pandemic. It's that it really did shine a light on some critical failings, I think, in our society and in our economy that it's a warning sign of things we need to address.
The American healthcare system was woefully prepared and staffed to some degree, and by extension, the senior living centers as well to deal with this. What did you find when you took a deep dive into that?
So I think we've allowed profits to become the dominating force in both senior living and in hospitals. And one of the things I've thought a lot about is there are areas where capitalism works really well, and perhaps there are other areas where it doesn't. And our critical infrastructure, such as hospitals and senior living homes, may be a place where the single-minded pursuit of profits isn't how we want these places to operate. And over recent decades, we've allowed private equity firms to take big ownership of bigger and bigger swaths of both hospitals and nursing homes. And in order to make money for their investors, which is what they're supposed to do, they've often cut costs and cut staffing to the bone, and they left a very debt-ridden, tottering healthcare infrastructure even before the pandemic hit. And that's one of those things. I think this is an opportunity to open our eyes and look at this and say, is this really how we want to be treating our seniors? And if our nation isn't healthy, what does that mean for our future? And what should we do about that?
I learned for myself, I mean, eyes wide open now, but so many of the senior living centers are corporate owned. And there definitely was that theme of profits before people. They were woefully understaffed. And once COVID got into some of them, it was lights out.
Yes. And the reverberations going on are quite shocking also, because the staffs at hospitals and nursing homes were already stretched to the bone, just like our supply chains were stretched to the bone. Everything had just been stretched in the name of efficiency to the breaking point. And so now you're seeing mass resignations among nurses and staff in nursing homes because they simply can't take it anymore. Yeah. So that's why another reason why I think it's important to understand what happened. It has real repercussions for the future.
Let's talk about this, Bethany. CDC and the FDA and Dr. Anthony Fauci, he was kind of the principal spokesperson out there, leading the response to the pandemic. Praised by some, highly criticized by others. What did you find in their research? While their motivations were very well-intentioned, they missed the mark over and over again in some regards.
I think everybody's intentions were good, and I also think this was a first. Every other pandemic the world has seen basically since 1918. There was one small one in the 1950s, but has bypassed the US. So you have to see people's actions in that context. Nonetheless, I think there was a rush on the part of public health officials to say we knew things when we didn't know things. And I think I don't know, but I think would go a long way in the world. Following the science is, in the end, an art of asking questions and weighing the evidence as it comes in. It's not being stuck with one answer. So I think public health wanted to push for surety when they didn't really know. And then I think our leaders, our politicians, too often put public health officials in charge instead of stepping up themselves. And what I mean by that is that any public health official is going to tell you, shut down society, save people's lives. A leader, a politician, is supposed to say, you know, the economy matters too. If people can't make a living and they lose their businesses and they lose their jobs, that affects people's health too.
We could talk about this for hours.
I know we could.
The lockdown, the masks, online learning, all of that, you deal with it in the big fail. So, it's not light reading by any regards or any means, but it's certainly would you do yourself a favor by reading this book. So we thank you so much for being here. And if we had an hour more, we still wouldn't be able to get to all of this. So Bethany, thank you again. The book is called The Big Fail, and you can follow Bethany on X. Dana.